Hello everyone, welcome to Sunya IAS and welcome to this lecture. In this lecture, we are going to study about universal health coverage, a very important and probable topic for your GS2 as well as GS3 examination. So, आज हम ये cover करेंगे. When we are covering these mains centric topic, it is your responsibility that no matter whether you are going for the handwritten notes or you are going for the Sunya IAS books, GS books. No matter how you are taking these classes and making notes out of it, whether it's the books or the handwritten notes, your responsibility is to revise them. Okay, because seeing the lecture once will not suffice. Your brain is not wired like that. No one's brain is wired like that, that you will remember everything just by listening to it once. And that is why the key to UPSC is revision. So whatever facts I tell you, whatever things I tell you, whatever introduction, conclusion, pointers I tell you, it is your responsibility that you keep on going towards that paper by paper, right? So this particular topic, that is universal health coverage, as you can see very clearly from the name itself, that it is relevant for the health, from the health point of view, also relevant from the society point of view. Even in GS1, when you are suggesting way forward, when you are suggesting how you can tackle poverty, how you can tackle the disadvantaged section, universal health coverage is a very important aspect of it. Now of course, when you mention it in subjects in papers like GS1 in the topic of society, that will be just a point, just a small point. But overall, as a topic in itself, it is very important that you cover it, because a separate 10 marker or even a 15 marker can come up in this regard. So you can be asked questions like, is universal health coverage feasible? Or what is the regime of universal health coverage in India? So you have to know the existing schemes, you have to know the drawbacks, you have to know where we are lacking, and you have to suggest some efficient way forward. That's what mains is all about. Okay. So let's start. Before importance of universal health coverage, let's just finalize a definition, a very good definition for it. See, universal health coverage means that all individuals and communities, just write this down, all individuals and communities, there are some keywords to all definitions. So all individuals and communities can obtain quality healthcare services, at all levels. So primary, secondary, tertiary level. Quality healthcare services at all levels, and the most important part of this definition would be without bearing any financial hardship. Without bearing financial hardship. This is the most important part of it. Okay. Because even in India right now, there are very good hospitals, private and public hospitals, which are giving quality healthcare services. But when they are quality healthcare services, they are very expensive. Okay. So the core part of universal health coverage is without bearing financial hardship. Okay. This is your definition. Now, let's come to why it is important. Before that, just think about one scheme that should immediately click into your mind, and that is why active learning is very important. Don't just listen to me speak. Also think about, what do I know about this topic? So for example, when I talk about Ayushman, see, it came out of my mouth itself. The Ayushman Bharat. So Ayushman Bharat scheme, it has two components. One is the primary healthcare centers. Okay. The primary healthcare centers, 1.5 lakh primary healthcare centers is the aim, and quality primary healthcare centers. The second aim is Pradhan Mantri Jan Arogya Yojana, wherein 5 lakh per person health coverage is given to everyone who pays a very small amount of premium, right? So this is the primary healthcare aspect of it. This is the insurance aspect of it. And this is the one of the largest healthcare coverage schemes in the world. Okay, so just have this in mind. This is a very important part of your universal health coverage. And when you start making points, immediately you should be able to think that this is only primary healthcare. Okay, what about the secondary healthcare? What about the tertiary healthcare, which is the most expensive? As soon as you, like, I do not wish it on any one of you, but whoever gets admitted into the hospital, it is the most stressful time, not because of the medical conditions only, but also because of the amount of money that you will have to shell out, especially if you are not insured. Even if you are insured, then even out of pocket expenditure in India is very high. It is 47%. So if you are spending 100 rupees, out of that 47 rupees goes out of your own pocket, even if you are insured. Okay, so out of pocket expenditure is very high. Keeping these things in mind, just let's see the very obvious reasons why universal health coverage would be important. Now, these reasons might come off as very obvious to you, but when you write them down in a structured manner with some data here and there, with some facts here and there, then you can actually grab the attention that he's not just writing generic vague points, but also adding value to it. So, socially, it will lead to access to services to all the sections of society. So access to services and access to quality of services, which will ultimately lead to human capital formation. And why do we need human capital formation? Because we need our country to go forward. So human capital formation would add to our demographic dividend, no? Demographic dividend. When we complete 100 years of our independence in 2047, we do not want to hear episodes like the donkey route episode, the recent movie that came up, Donkey, and the very, very painful topic that it touched upon, that how Indians keep on leaving the country in the search of better life for themselves and their children, and how tough the route is for that. So recently, a flight with more than 300 people, which was headed to Nicaragua, which is a country wherein the domestic visa requirements are not very stringent. And from this country, people escape to the United States of America through the dense jungles and very, very difficult route. Why? Just to escape living from India. Escape from living in India, right? Why is this situation coming up? Because health is a very important aspect of it. People are not sure that if they will fall ill, the state will take care of them. Okay, that is a very big problem. And that is why universal health coverage will go a very long way in establishing that faith that if you or your loved ones are not okay, the state will take care of you. And that is what a welfare state is, if you think about it. Economically, the social benefits will give a domino effect. So financial benefits will come up. When people have to spend lesser amount on their medical expenses, their disposable income rises. Fine. Their disposable income rises. And when then their disposable income rises, economy also booms a lot. If let's say a person is earning 30,000 per month, and God forbid they had to be hospitalized, and 20,000 went into the hospital expenditure because they had to be admitted, right? Then the person would not be able to spend, right? But if that admission, let's say 20,000 ka kharcha hai hospital ka, and out of that the person has to give only 5,000, then 15,000 additional is there with the person to actually spend on himself and his family, and that is how the economy booms, right? So financial benefits are there. Then poverty levels are also reduced. Very important. It leads to reduction in poverty level, and during COVID-19 it was seen that because of high out of pocket expenditure, despite the Ayushman Bharat scheme, the high out of pocket expenditure led to many people going back to poverty, right? Because their expenditure was so much, their health expenditure was so much. Long term economic development, as I just told you, that people will not leave India for the fear of lack of a good lifestyle, and effective health facilities, efficient health facilities, and affordable health facilities are a very important part of standard of living. That's why whenever standard of living is estimated anywhere, health, education, and income levels, these things are taken primarily, right? Then overall, in achieving our SDG goals, good health and well-being is our SDG goal number 3. And please write down, within SDG goal number 3, there is SDG goal number 3.8, which says that we should achieve universal health coverage. See, there are the Scandinavian countries, and we'll talk about some of them. There are Scandinavian countries which have very high rate of taxation. So they will tax 50% of your income. That is the norm. There, the population is not so much, so the level of income is also higher. But when 50% of your income is taxed, your fears are gone that I can send my child to the public school. I can go to the public hospital whenever the need arises. I don't have to shell out that extra money. But for getting that security, I am every month giving 50% of my income approximately. In India, the highest tax slab is 33%. यहाँ पे आप half of your income दे रहे हो, यहाँ पे आप 1/3 of the income दे रहे हो, right? But even with 1/3 of the income, you are not even getting partial amount of that security that you are getting in the Scandinavian countries, है ना? You would never want to go into a public hospital because of just the lack of facilities that are there, the lack of and especially the lack of hygiene. Although a lot of schemes are going on right now, but the fact is that given a choice, people in India would not want to go into public hospitals. So that image has to be changed, right? And these are the barriers that we will talk about, that which I just mentioned. We will talk about it in a systematic manner. So economically, there is imbalance in resource allocation. Very recently, we have been able to achieve 2.1% of our GDP into health. Right now, we are spending 2.1% of our GDP into health. Otherwise, we were just hardly spending 1.5, 1.6% of our GDP. And our goal is also not very lofty. Our goal is just 2.5% and reaching it to 3%. Developed countries spend about 15 to 18% of their GDP on healthcare. And it is not just curative healthcare. Okay, we have talked about it. Even preventive healthcare is very important. Okay, preventive healthcare is very important. And how do you get that money to engage in preventive healthcare? How do you stop the diseases from happening? You establish mechanisms like fat tax. If a company wants to sell chips, if a company wants to sell cola, these kind of things, they have to pay a fat tax, because ultimately these kind of things, if a company wants to sell tobacco products, these kind of things will impact the health. So if you want to impact the health of people, pay for it. If people want to impact their health, they have to pay higher for it. And that extra revenue that is coming out of these kind of fat taxes, they will be used in generating awareness that please don't have these kind of things. So it's all a cycle. It is all a cycle, and it is very doable, and we have started doing it. Eat Right movement is there, Fit India movement is there. So many things are there. They are happening at the national level. Right now we are in the international, just this year is ending, but 2023 was the international year of millets. So these things are very important. Then yoga day, we have basically raised awareness for yoga day. But again, nothing can make up for universal health coverage. That's security. Okay. So resource allocation में problem है. Poor infrastructure है हमारा. What is our doctor to patient ratio? 1:1456. So one doctor for 1456 people. WHO mandated ratio is 1:1000. So 456 लोगों का difference है, a large difference. Then lack of skilled professionals, same thing. High out of pocket expenditure, as I told you, 47% we have to shell out. And profiteering is a very important aspect, because see, अभी हम जैसे generic medicines की तरफ भी जा रहे हैं. Generic medicines. So going towards generic medicines through Bharatiya Jan Aushadhi Yojana. Jan Aushadhi Yojana. What is this? This is a part of universal health coverage, because once you take away that consciousness from the mind of people that I have to go only for the branded medicines, no matter how expensive they are, I'll just have only the branded medicines, then the coverage automatically increases because the access to medicines increases. So Jan Aushadhi Yojana is also a very important aspect of universal health coverage. Everything that helps you in attaining good health levels are a part of universal health coverage. Then socially, there is gender inequality, and it has been a proven fact that wherever females are given the charge of health, the deliverables are higher, the outcomes are better. How? Just look at Anganwadi workers. The vaccination, the polio vaccination whole project. How did it happen? Because जो घर घर लोग गए थे, they were mostly females, right? And they are able to attain a more sensitive approach. But then when you talk about the medical profession, there is inequality in women representation, right? Women representation में inequality है. Not a lot of women are able to climb up the ladder. Okay. Then rising aging population is also a very big problem. We do not have enough geriatric care. Geriatric care बोलते हैं the care of the elderly को, right? So geriatric care नहीं है हमारे पास. Some startups are coming up, but an overall national policy against isolation of the elderly, against diseases of the elderly. We do have a policy for palliative care. We have talked about it. एक अलग से lecture भी है इसका. Palliative care की policy है, but that policy, how much does it translate into it? Just think about what are the options available to old people if their children desert them. And that fear of being deserted is also leading to either people not having children at all or having more children than they should. कि चलो अगर एक ने desert कर दिया तो there are 2 more, 3 more, these kind of things. So that security is not there. Okay. Then social determinants of health. So for example, caste determinants, religion as a determinant. These are very prominent. Okay. So these things. जैसे for example मैं आपको बताती हूँ. There was this study that is being conducted, wherein the talk was going on about sickle cell anemia. Sickle cell anemia. Now, what is sickle cell anemia? Wherein your red blood cells, which should be like this in a round shape, they gain a sickle shape. This is a sickle shape sort of a thing. So when they gain a sickle shape, they actually cause obstruction in blood flow and then progresses to cancer. So sickle cell anemia is prevalent more in tribals. And this is a proper research that has happened. It happens more in tribals because of malnourishment, because of extreme exposure to tobacco, because of a lot of living styles wherein there is no regulation, there is no health facilities being given to them. So that's why these kind of things, sickle cell anemia impacting tribals more than the non-tribal population, what does it mean? That there are social determinants of health which we are not able to control, and health is not a blanket scheme, you know. Health impacts every section of the society differently. So for example, if you talk about women, you definitely have to talk about menstrual health. There is no way that you will not talk about menstrual health, right? So these are the things. The social factors cannot be eliminated. Okay. Then governance. Governance में there is policy paralysis. Why? Think क्यों होगा policy paralysis? Primarily because health is a state subject. ठीक है. तो पॉलिसी पैरालिसिस इसीलिए ही होता है बिकॉज लेट्स से आयुष्मान भारत जन आरोग्य योजना भी है. इवन इन दैट स्कीम मेनी स्टेट्स डिड नॉट ज्वाइन इन. ठीक है, क्योंकि प्रीमियम तो स्टेट्स को भी पे करना पड़ेगा ना. सम ऑफ द एक्सपेंस वुड हैव टू बी टेकन बाय द स्टेट्स ऑल्सो. सो दैट इज प्रॉब्लम. Then there are management issues when it comes to the hospitals, the infrastructural issues. ठीक है. पॉलिसी पैरालिसिस में आप ये भी देखो that for example examinations like NEET, we are saying we have a lack of skilled personnel. Examinations like NEET, Tamil Nadu passed a NEET bill to make sure that NEET is not a mandatory exam to become a doctor, है ना, because health is again a state subject. But what happened? More than a year passed and the governor had reserved that bill, not passed that bill at all. ठीक है, तो यही पॉलिसी पैरालिसिस होता है. क्यों होता है ये? बिकॉज हेल्थ इज अ स्टेट सब्जेक्ट. डज इट मीन दैट हेल्थ शुड बिकम अ यूनियन सब्जेक्ट? Not necessarily. That is not the solution, and that is against the federal spirit of our country as well. The thing is that health has to be seen as a very strong solution to achieve the demographic dividend, not as a political gain. Okay, so it's a state subject. Then there is unavailability of public health centers. See, public health centers जो आयुष्मान भारत के अंदर बन भी रहे हैं, they are not focusing on the urban areas. वो rural areas पे focus कर रहे हैं. And urban areas में जहाँ migrants हैं, the migrants who are coming from the rural areas to urban areas, because agriculture is saturated and cities have the new opportunities. So those migrants are not getting that kind of opportunity that they can go to good healthcare centers. And identification of services is also a problem because the kind of diseases that are coming up, they are increasing. So for example, let's say you are talking about mental health. Let's say आप mental health की बात करते हैं. हमने mental health के बारे में भी बात की है. There is a lecture uploaded over there, you can see. So mental health, do you think that if someone is suffering from mental issues, they'll be able to go to primary healthcare center and share कि this is what I'm feeling or I'm having these symptoms and everything? No. तो जो एक पूरा identification of services है वो problematic हो जाता है. साथ ही साथ में all India medical services अभी तक create नहीं हुआ है ना. There have been very strong recommendations. जैसे recently our president recommended that all India judicial services should be created. Similarly, there have been recommendations for all India medical services also. Just like you are preparing for the UPSC civil services examination, so that is civil services. We should also be having medical services. We should also be having judicial services so that there is a standardized way of operation. And जो efficiency हमें civil services में देखने को मिली है वो हमें medical में भी देखने को मिले. And there should not be silos. There should not be silos while they are working. ठीक है? Health is a very important aspect. Then technology, there is digital deficiency. For example, Ayushman Bharat digital health mission जो है अपना, that aims at creating a digital repository of all the healthcare functionaries. It aims at creating a digital repository of your own health record. But there are so many people who are highly impacted by health issues who do not know how to operate a smartphone yet. है ना, जैसे हम सिकल सेल अनीमिया की बात कर रहे थे, तो how many tribals, the real tribals who are there in the jungles, they have access to the smartphone and the Wi-Fi and the internet connection? Very few, right? Then equipment is a problem. The medical equipment, है ना, we are import dependent when it comes to ventilators, when it comes to the CT scan machines, MRI machines, the operation apparatus, we are import dependent. So when we are import dependent, there is a lot of expense and there is difficulty in setting up these kind of um, hospitals and you know, clinics. So that becomes the problem. And research, of course, overall our research expenditure is very low, and health research is a sub part of it. Most of our research now is going towards fancier domains like space, like defense, which is not a bad thing. But health research is extremely important. Health related research is extremely important. And budgetary deficit is there. ठीक है? So these are the challenges. You can take these four approaches, that is economic, social, technological, governance, and you can take some of these points, ठीक है, 2 to 3 points per approach, and your portion of challenges for universal health coverage would be done. ठीक है, that is there. Then now let's come to why there should be a universal health coverage. Because our constitution mandates so. Does it say that there has to be a universal health coverage through a separate article? No. ऐसा नहीं लिखा गया कहीं पे भी. But there are some unwritten things. For example, Article 21. Article 21 is right to life and liberty and life with dignity. ठीक है, तो आर्टिकल 21 में सुप्रीम कोर्ट ने मल्टीपल जजमेंट से ये इंटरप्रेट किया है दैट राइट टू लाइफ इंक्लूड्स राइट टू हेल्थ ऑल्सो. सिमिलरली मेनका गांधी केस में एक्सेप्ट किया है दैट राइट टू लाइफ इज नॉट जस्ट राइट टू एनिमल एग्जिस्टेंस, not just animal existence. आज की डेट में where we are thinking about how to treat animals better, we are thinking about how to reform the dairy sector, how to reform the poultry sector, all of these things we are thinking about, then how can we even expect that humans would be expected to have an animal existence? That is not possible. So Article 21 is a good basis that you can write as a part of your answer, that why universal health coverage should be there. Then there are, in DPSP, there are further articles. So for example, Article 43 is there, the health of workers and maternity relief. Article 41 is there. Then Article 46 is there. Article 46, the health and education of the socially and economically backward classes. ठीक है, तो ये सारी चीजें इंपॉर्टेंट हो जाती हैं. 46, 47 ये आर्टिकल्स जो है अपने इंपॉर्टेंट हो जाते हैं. सो दीज थिंग्स. इसके अलावा पॉलिसी मेजर्स में क्या क्या है? When we talk about universal health coverage, you need to mention कि we have taken a, let's say, a very haphazard kind of stance towards universal health coverage, but ऐसा नहीं है कि we have not done anything in that domain. We have implemented various schemes here and there, and when you join them and see a bigger picture, you see that a large amount of our population is insured, health insurance is there, large amount of population has access to cheaper health care, that is there. But then there is no universal policy. जैसे for example, universal policy कैसे होती है कि आपने women reservation bill पास कर दिया, 106th Constitutional Amendment Act आपने पास कर दिया, and now the Lok Sabha and state legislative assembly seats are effectively reserved, 1/3 seats are reserved for women. This is an umbrella policy. ठीक है, ये constitutional amendment है. तो umbrella policy तब होगी when a constitutional amendment is made. ठीक है, एक separate body बनाई जाएगी, इस तरीके की चीजें. But here we have the National Health Mission, we have Pradhan Mantri Jan Arogya Yojana, we have National Nutrition Strategy, प्रधानमंत्री स्वास्थ्य सुरक्षा योजना है हमारे पास, नेशनल हेल्थ पॉलिसी द मोस्ट रीसेंट वन, एंड जन औषधि परियोजना। ठीक है, ये सारी ऑलरेडी एग्जिस्टिंग पॉलिसीज हैं विच आर ट्राइंग टू मेक हेल्थ केयर मोर एक्सेसिबल, बट अगेन कोई एक अम्ब्रेला फ्रेमवर्क नहीं है, जिस वजह से अपना गैप हमें ये फील हो ही रहा है। नाउ लेट्स कम टू वेरी इंपॉर्टेंट एस्पेक्ट, और ये नाउ दैट वी आर लिविंग इन अ ग्लोबल विलेज, है ना, इवन आवर एक्सटर्नल अफेयर्स मिनिस्टर हैज सेड दैट वी आर अ ग्लोबल वर्क स्पेस, वी आर अ ग्लोबल विलेज। तो हमें ये जानना बहुत जरूरी है कि ग्लोबली हेल्थ केयर और यूनिवर्सल हेल्थ केयर पर क्या क्या काम हुआ है, कौन सी ट्रीटीज हैं, विच कंट्रीज हैव डन अ रियली गुड वर्क। ठीक, सो द वेरी इंपॉर्टेंट वेरी इंपॉर्टेंट थिंग, एंड डायरेक्टली इससे सवाल भी आ सकता है, आपसे पूछा जा सकता है कि व्हाट हैज इंडिया डन टू अचीव द गोल्स लेड डाउन बाय अस्ताना डिक्लेरेशन। अब वहां पे ऐसा नहीं होना चाहिए कि अस्ताना डिक्लेरेशन आपको पता ही नहीं है। सो अस्ताना इज इन कजाकिस्तान एंड दिस डिक्लेरेशन वाज ऑन universal health coverage. The aim was, and please write this down, the aim was everywhere everyone is able to enjoy highest possible standards of health, highest possible standards of health। ये अस्थाना डिक्लेरेशन ने बोला था कि एवरीवेयर एवरीवन इज एबल टू अचीव हाईएस्ट स्टैंडर्ड्स ऑफ हेल्थ, हाईएस्ट पॉसिबल स्टैंडर्ड्स ऑफ हेल्थ। नाउ जस्ट थिंक अबाउट इट, प्लेसेस लाइक गाजा wherein every day people are dying in tens and hundreds, how do you expect that this Astana declaration is being fulfilled? So ऐसा नहीं कि India is doing very bad, but then we should not be comparing ourselves to places like Gaza, है ना। There are some politicians wherein who are using the example of Gaza very loosely. I have seen that there are some people who are giving very loose statements regarding Gaza, and as a future bureaucrat it is your responsibility that whenever such a crucial juncture is there, you do not use it very loosely like that. Okay, then universal health coverage by 2030. I told you SDG 3.8 is aiming to universalize healthcare. So SDG 3.8, very important. Then we have P4H social health protection network। ठीक है, P4H social health protection network जो है, it is basically the only global framework for health collaboration, only global framework for health collaboration, and this includes World Bank, WHO, ILO, all of this it includes। ठीक है, तो ये आपका, ये आप लिख सकते हैं, ये पॉलिसीज हैं, ये पॉलिसी मैटर्स है, ये इंटरनेशनल लेवल पे की गई कुछ डेलिब्रेशंस हैं विच यू कैन राइट in the same point in your answer. You don't need to write 4 separate points, please know that. Okay, and then there is SDG 3 gap, there is global action plan for healthy lives and well-being for all, global action plan for healthy lives and well-being for all। ठीक है, तो ये आपका एसडीजी की तरफ ही फोकस करता है। ठीक, दैट इज देयर। सो आफ्टर दिस वन थिंग एंड अ वेरी इंटरेस्टिंग अप्रोच विच वी कैन गो टूवर्ड्स, क्योंकि हम सीधा तो यूनिवर्सल हेल्थ केयर पर नहीं जा सकते, वी कैन गो टूवर्ड्स हॉप्स, दैट इज हेल्थ केयर एज एन ऑप्शनल पब्लिक सर्विस। अगर आपको याद हो तो हमारा स्वच्छ भारत सेस अप्लाई किया गया था, राइट, स्वच्छ भारत सेस, व्हेन स्वच्छ भारत अभियान वाज इंट्रोड्यूस, स्वच्छ भारत सेस वाज अप्लाइड। व्हाट वाज द रीजन? एक ओवरऑल पॉलिसी क्रिएट करने के लिए, एक ओवरऑल पब्लिक बिहेवियर क्रिएट करने के लिए, राइट। सो दिस इज कॉल्ड एन इंक्रीमेंटल अप्रोच, और हम ये ऑलरेडी कर भी रहे हैं, but we need to take an incremental approach and see healthcare as an optional public service rather than having universal health coverage from the starting, which will be very heavy on our public system also. Here we can start as healthcare being provided as a free public service. फॉर एग्जाम्पल, आप अपने जो हॉस्पिटल्स हैं, हॉस्पिटल्स की कंडीशंस को आप बेटर कीजिए. यू इंप्रूव द कंडीशंस ऑफ हॉस्पिटल एंड यू से दैट these all services will be completed, will be given to you for free, है ना. If you're coming for a basic cough or cold, if you're coming for basic fever, general checkup, blood pressure, sugar, these kind of things, there is no charge that you will be taken, जो आपसे लिया जाएगा, right? So these kind of things you can start with that. ठीक, so इसे हम बोलेंगे हॉप्स, और ये हॉप्स आप जरूर मेंशन करें, right? These are routes to achieve universal healthcare coverage. So you take healthcare as a public service. How will you take healthcare as a public service? You will initiate the All India Medical Services. ठीक है, this is not the AIIMS Hospital, All India Institute of Medical Sciences नहीं है ये. This is All India Medical Services, just like the All India Civil Services है हमारी, right? Then social insurance already हमारे पास है, प्रधानमंत्री जन आरोग्य योजना. बट इवन डिस्पाइट दैट हमारा जो इंश्योरेंस डेंसिटी है वो इट इज वेरी स्पार्स, राइट? सो वी नीड टू इम्प्रूव दैट. देन दिस मॉडल यू कैन सजेस्ट कि कनाडा में क्या होता है, जैसे हमारा स्वच्छ भारत टैक्स था, यू आर चार्ज्ड यूनिफॉर्मली फॉर द हेल्थ केयर एस्पेक्ट ऑफ इट. Uniformly you are charged, and then all that money which is collected, it is given to a non-profit organization who runs the entire public services. So it is kind of a public private partnership. देखो simple सी बात है, human nature works like that, that till the time you are not incentivized, till the time incentives are not given to you, you will not be willing to work that hard. ठीक है, अगर बेस सैलरी आपको इतनी मिल रही है और उसके ऊपर आपको काम के बेसिस पे इंसेंटिव मिलता है, योर परफॉर्मेंस ऑटोमेटिकली इंप्रूव्स. सो दैट काइंड ऑफ अ मॉडल नीड्स टू बी अप्लाइड ओवर हियर एज वेल. ठीक है, एंड ओवरऑल a HOPS framework we need to devise wherein healthcare is an optional public service. And for example, आप इंडिया का ही एग्जाम्पल इसमें लिख सकते हैं, आप केरला का एग्जाम्पल लिखें, आप तमिलनाडु का एग्जाम्पल लिखें, आप दिल्ली का भी एग्जाम्पल लिखें, राइट? वेर इन यू हैव दोज मोहल्ला क्लिनिक्स विच स्टार्टेड ऑफ विद अ लॉट ऑफ फैनफेयर. अभी थोड़ा सा मेंटेनेंस और उसमें इश्यूज आ रहे हैं, बट ओवरऑल हॉब्स फ्रेमवर्क में कि आप एज अ पब्लिक सर्विस हेल्थ केयर को प्रोवाइड करें, राइट? सो इट विल बी अ बिहेवियरल मूव, जैसे हमारा स्वच्छ भारत अभियान था. इट विल ओवरऑल कवर द प्रोसीजर and it will be a very good step towards universal health coverage. And universal health coverage does not mean unlimited health coverage. For example, this is very important, जब आप प्राइवेट इंश्योरेंस करवाते भी हैं, they ask you, are you a smoker, है ना, they ask you that. तो ऐसा नहीं है कि because you are irresponsible the state should pay for that. But if you are genuinely not feeling well, if you are genuinely ill, then the state is there for you. तो ऐसा नहीं है कि you are an alcoholic, you are a smoker, and intentionally so you are not stopping, you are not making any efforts also towards it, then also the state will cover for you your expenditure for expensive treatments or rehabs. No. So UHC does not mean unlimited health care, but it does mean that the basics will be covered. Fine, the basics will be covered. So in way forward, we need to increase per capita expenditure on health. This is the primary thing, and we need to take it to 5 to 6% of GDP. The expense made on health needs to take it to 5 to 6% of GDP. 2.1% is not enough. Then non-medical preventive health, if that is improved, for example, as I told you, Fit India movement, or the Yoga Day, International Yoga Day, 21st June. These kind of initiatives will develop a culture of health, and that is what will improve the health indicators. Then there is women empowerment, ending social evils, addressing regional disparities, augmenting health cadre management. हमेशा ऑल इंडिया मेडिकल सर्विसेज जरूर मेंशन करो, बिकॉज दैट विल एक्चुअली हेल्प अस to get over the silos that is created because of health being a state subject. ठीक है, ये है. परफॉर्मेंस इंसेंटिव्स दो हॉस्पिटल्स को, नर्सेस को. फॉर एग्जाम्पल, द आंगनवाड़ी वर्कर्स आर गिवन इंसेंटिव्स on the basis of how many households they cover for immunization. ठीक है. Then shifts in educational curriculum and policy focus has to be maintained. And technologically, we have already done आयुष्मान भारत डिजिटल हेल्थ मिशन. ठीक है, तो इसके जो डेटा कंसर्न्स हैं, प्राइवेसी कंसर्न्स हैं, इनको रिजॉल्व करना बहुत जरूरी है, सो दैट मोर एंड मोर पीपल can adopt the Ayushman Bharat Digital Health Mission and actually go forward with towards the journey of universal health coverage. Best practices 3 आप मेंशन कर सकते हैं. वन इज चिली, जहां पर एक मैंडेटरी टैक्स लगाया जाता है. ठीक है, मैंडेटरी टैक्स लगाया जाता है फॉर यूनिवर्सल हेल्थ केयर, जस्ट लाइक द स्वच्छ भारत मिशन. सो दिस इज इंपॉर्टेंट. देन घाना का मॉडल जो है वो ऐसा है कि जो आपके कंजम्पशन टैक्सेस हैं, है ना, जिस गुड्स एंड सर्विसेज टैक्स हो गया, उस पे आपका 2.5% का टैक्स लगाया जाता है. सो दैट इज वेरी इंपॉर्टेंट. एंड जापान में whichever healthcare system, whichever healthcare solution is very expensive, the Japanese government gives subsidies for that. So for example, अगर अपना कैंसर का ट्रीटमेंट है या फिर मतलब बहुत कुछ ऐसे रेयर डिजीज है, तो जापानीज गवर्नमेंट इज देयर टू टेक द ब्रंट ऑफ इट दैट वे, है ना, ताकि सिटीजन शुड नॉट बी, ऐसा नहीं होना चाहिए कि सिटीजन की सारी सेविंग्स ही चली गई उस ट्रीटमेंट में. ओके, so yes, universal health coverage, very very important topic, can be asked as a separate 10 marker or a 15 marker, and otherwise when we write a question on health and answer on health, universal healthcare becomes an important point over there. So I hope you derived some value out of this lecture. I have already told you about the notes, how you are supposed to make them or order the Sunya books. So yes, that is all for today. I will see you all in the next class. Thank you for watching. Bye bye.